Hi, everyone. We're going to give a couple minutes for people to trickle in, and then we'll get started. We'll get started here shortly, maybe another minute or so. Let some people trickle in for the lunch hour. Alrighty, my friends. Well, we should go ahead and get started. I'm super excited to be hosting this month's webinar. It's been a while since I've done one of these, so hopefully we can brush off some presentation skills. These are topics that I'm really passionate about. I love talking about this stuff with my patients and most of our consults. So if you've had the pleasure of, or if I've had the pleasure of working with you, then this is likely something that we've talked about in your consult with us. So we will get right into it, and some people will start to trickle in, I'm sure. So welcome to the February webinar. This is the heart of hormones. So all things testosterone, love, and cardiovascular health. What every man and woman should know this Heart Health Month, if you didn't know that February was Heart Health Month. So let's get going. There's a little bit about me. You can also look at our website if you want to learn more about my background. So why Heart Health Month should include hormones. So since February is both Heart Health Month and the month of love, I wanted to combine those themes and talk about something that's often overlooked in cardiovascular medicine, and that's hormones and hormone therapy. Today, we're going to focus mostly on testosterone, both in men and women, and how it impacts cardiovascular health, your metabolic health, your energy, your libido, and your overall longevity, which is something we talk about a lot. We'll also briefly touch on a couple different fun peptides, since peptides are all the rage these days: oxytocin, PT141, and sermorelin, and how they fit into the broader conversation of desire and love, but also cardiovascular health. My goal is that you'll leave here understanding that testosterone is not just a sex hormone. It's a metabolic hormone, it's a cardiovascular hormone, and it's a longevity hormone. So it plays a lot of different other roles than just being a sex hormone. So let's talk a little bit about testosterone here. So when most people hear testosterone, they think of muscles or libido, and that's all very true, but testosterone does a lot more than that. In both men and women, testosterone influences how our body holds on to lean muscle mass. It affects insulin sensitivity. So that's something I talk about with my patients a lot, is how do we get our cells to be more insulin sensitive, meaning that they process the sugar that you've got floating around a little bit more efficiently. It also helps with visceral fat accumulation. So the fat that's specifically around your midsection, particularly on the inside of your abdominal cavity, super inflammatory, really naughty. It helps with lipid metabolism. So all of your cholesterol panels, if you have a history of high cholesterol, it can help with that. It also helps with bone density. So a lot of my menopausal men get osteoporosis too. It's wildly underdiagnosed, but it does help with bone density. Helps with mood and motivation. So your drive to get out of bed every morning, your drive to get stuff done each day. It helps with endothelial function. So when we say endothelial function, the inside lining of your blood vessels, so all your veins and arteries, helping with that muscle. It helps with your libido. Obviously, that's a really big one. And it helps with nitric oxide production. And we'll touch a little bit on nitric oxide later in the presentation and how important that is and kind of what that does. Low testosterone has been associated with all the things that are opposite of this list. So increased visceral fat around your midsection, which can in turn cause a lot of higher inflammatory markers. If you've ever had a high CRP or maybe a homocysteine, that, testosterone could be negatively impacting that. Insulin resistance, so the opposite of insulin sensitivity, meaning that your cells do not process sugar at all appropriately. And so you're at higher risk for it being stored as adipose tissue or fat. And then lower HDL molecules. Now, HDL is one of our happy cholesterol molecules. So H stands for happy. And we love having HDL floating around because it does a couple very important things and it's very beneficial for us. And then higher cardiovascular risk. So if you've got a family history of cardiovascular disease or you have a personal history of cardiovascular disease, having high testosterone can be protective for those types of conditions. And then depression and low drive. So again, that mood and motivation, the opposite. If you've got low testosterone, you might be feeling down, maybe suspicious of a little bit of depression, but that might be an indication to get your hormones checked. And what's especially important is that low testosterone and metabolic dysfunction, which is where I would group all of these things and all of these symptoms, they feed into each other. So as visceral fat comes up, as we accumulate a little bit more around our midsection, our testosterone is naturally going to go down. That can, and that's going to drive testosterone down, and then more visceral fat's going to accumulate, and then your testosterone is going to get lower, and then you get stuck in this negative feedback loop where we can't get out of it. And so low testosterone contributes to metabolic syndrome, but metabolic syndrome also further lowers testosterone. So there's great ways to get out of it, and that's to optimize your testosterone levels. Testosterone and metabolic syndrome, we kind of touched on this a little bit, but I do want to highlight metabolic syndrome specifically because I see a lot of patients with this in practice. So a little bit of that central obesity around our midsection, elevated triglycerides, which are going to be the really terrible, T for terrible, cholesterol molecules. These guys are small, they're sticky, so they have a higher risk of sticking to the inside walls of the arteries and causing things like plaque buildup. Low HDL, elevated blood pressure, if that's ever been an issue for you, and insulin resistance again. But we also see those elevated inflammatory markers and overall mortality. So there's a couple different studies that I like to highlight here that really emphasize the mortality. There's a couple cohort studies that have shown that men in the lower testosterone quartile, and the studies are always on men, and we've got to change that. More studies need to come out on women. So from a basic biology point of view, a lot of these theories can be applied to female physiology as well. But for the sake of the study, it's all on men. So men in the lower testosterone quartile have approximately a 30 to 40% higher all-cause mortality. And what we mean by all-cause mortality is that just your risk of dying from anything, cancer, cardiac, whatever it might be. So 30 to 40% increased risk of all-cause mortality compared to men with normal levels of testosterone. That's a pretty big difference. And the risk is even more pronounced in men who have metabolic syndrome. So any one of these markers here on your screen. One important thing that I want to specify for this presentation is that low testosterone may function both as a contributor to disease and also a biomarker of underlying illness. So if we've got chronic inflammation, if we have diabetes, if we're struggling with some weight concerns, those can all suppress your brain and your testosterone signaling with each other, which can further lower your testosterone. So it's a very slippery slope that we go down. And this is why here at Desert Wellness specifically, we don't treat numbers in isolation. We treat your context. So that doesn't mean that testosterone is a magic cure. We do utilize testosterone in conjunction with other lifestyle and dietary changes, but it means that ignoring low testosterone in a patient with abdominal obesity, maybe some pre-diabetes, so if your hemoglobin A1C is a little bit elevated, or maybe your cholesterol panel isn't looking quite as optimal, if we ignore the testosterone component, we're ignoring a major piece to the puzzle. So it's very important to address. I want to focus a little bit more on testosterone and your cardiovascular health. Now, here's a very generic graphic for that kind of highlights all the ways that testosterone molecule in the middle there, supports cardiovascular function in several important ways. So we talked about this endothelial function and it's supporting the inside lining and the musculature of your vessels. So testosterone enhances this thing called nitric oxide activity. Nitric oxide promotes vasodilation, meaning that it'll expand your blood vessels, which can really significantly improve and support healthy blood flow. Reduced nitric oxide is a hallmark of this term endothelial dysfunction. And so having increased blood flow will help with things like if we've, it helps with erectile dysfunction. We'll talk about that a little bit more later, but it also helps with managing your blood pressure, improving blood flow to your brain, which is very important. And we're not in a situation where we don't want to have good blood flow. We want to have good blood flow. Lipid metabolism. So good levels, optimal levels of testosterone are generally associated with improved triglycerides. So again, those terrible cholesterol molecules, and better HDL, happy cholesterol balance in compared to deficiency states. Low testosterone is also associated with elevated inflammatory markers. So if I see labs come back and they've got elevated CRP or elevated homocysteine, I'm looking at testosterone a little bit more critically. Chronic inflammation drives things like plaque buildup on the inside of your veins, which could in turn cause you to be at higher risk for a cardiovascular event down the line. And then vascular smooth muscle, testosterone has a direct effect on vascular smooth muscle tone. So again, that endothelial dysfunction, it supports your sleep. So we love having healthy sleep. Sleep is foundational to our health. If we're not addressing any sleep concerns, then again, we're missing a huge piece to your overall health, and testosterone is really important for that sleep component. On this slide, I do want to carefully differentiate between physiological replacement of testosterone and what I would call supraphysiological replacement of testosterone. So when I say physiological replacement of testosterone, we're really looking to have our patients in an optimal range of testosterone. So it's never my goal to swing you from 0 to 500 for a female and get you to the super physiological dosing. If you're 60 years old, I'm not aiming to get you to 17 again. You might feel like you're 17 again, but we're really looking for those optimal ranges. The goal is balance. It's symptom improvement, it's metabolic support, and how we do this is we carefully monitor your labs. Supraphysiological dosing, or dosing that pushes the range really, really high, is often used for performance enhancement. So if you've been weary about going on testosterone for some other concern, or maybe that you don't want to, look a certain type of way, at those high levels of testosterone is what's going to get you there. And we're doing a little bit more optimization. So research-backed optimization for our patients. Really overly high levels of testosterone can cause the same problems as low testosterone. So if you've been on testosterone before and you've seen changes in maybe your CBC, that can be a really common occurrence for testosterone replacement therapy, certain types particularly, and that can cause a little bit of cardiovascular strain. So that's why we carefully monitor it. So important, I cannot hype this enough, that low testosterone is not just a male hormone. It is a female sex hormone as well. And my women come in and they have low testosterone and they think, well, what am I supposed to do about that? Because that's a male sex hormone, and that's just not the case at all. Women produce testosterone on their own in their ovaries and adrenal glands, and it plays a really critical role in libido and motivation. It plays a critical role in your muscle maintenance, and muscle is so important. The amount of skeletal lean muscle that you have on your body is one of the best predictors of overall longevity that we can have. So the more skeletal lean muscle you have on you, the better you are off over the long term. So testosterone is super important in building and maintaining that lean muscle in females. It's also important for insulin sensitivity. So if you're struggling with some weight, and you are doing all the things, you're exercising, you're eating all of the right things, and the weight's not coming off, you might have a little bit of insulin resistance contributing, and testosterone will make your cells more insulin sensitive, which is always the goal. And testosterone is super helpful for mood too. So having mood stability and being able to be motivated and get out of bed and have drive, it's very important. So low testosterone in the female body can look as low desire, or low libido, low energy, maybe some brain fog. That can certainly be a sign of low testosterone, low muscle tone, and increased fat gain. So the opposite of all the things that testosterone does benefit us. In perimenopause and menopausal women, declining estrogen and testosterone together can significantly impact your cardiovascular resilience. Optimizing testosterone in women with appropriate physiological dosing ranges, so again, not trying to turn you into a man, can support metabolic resilience and your overall vitality, which only over time is going to improve your quality of life and your overall longevity. So let's get into oxytocin. Enough about testosterone. Oxytocin, the love hormone. So since this is the month of love, we cannot ignore oxytocin. Oxytocin is often called the bonding hormone. It's released during connection, intimacy, touch, and positive social interactions, but it also impacts your physiology in a really beneficial way. So it's not just a feel-good hormone, it's got benefit for our cells. It reduces your cortisol, so that stress hormone, oxytocin, having that extra floating around can reduce your feelings of stress. It enhances your parasympathetic tone. So your parasympathetic nervous system is going to be your rest and digest. So again, kind of playing off that cortisol. It supports blood pressure regulation. So if we have a history of blood pressure, maybe you're somebody who's borderline high blood pressure, having extra oxytocin floating around can help regulate that. It improves emotional resilience. It supports bonding, intimacy, and it enhances emotional connection. There's some pretty robust research that suggests that chronic loneliness has been associated with increased cardiovascular risk, comparable to smoking or being in an obese category in some studies, which is crazy that somebody who suffers chronic loneliness is going to have the same cardiovascular risk as somebody who's a chronic smoker. So let this be a reminder to you that if you have somebody in your family or you know somebody who lives by themselves and doesn't have a strong support system, maybe this is the kick in the butt that you need to give them a call, because that's only going to benefit you as well to have that connection. So connection matters, intimacy matters, emotional regulation matters. Hormones are not just about chemistry. They're about physiology, interacting with your relationships and lifestyle. These things play an important role in our overall cellular health, which in turn improves our overall longevity. So healthy relationships literally are good for your heart. So let's foster those. Next is going to be PT141. It's the desire, the dopamine, and the heart health peptide. So what is PT141? It works centrally on the brain on certain different types of receptors to enhance your sexual desire. So it's a little bit different. It doesn't work quite like Viagra, which is a really common medication on the market right now, because it's not increasing blood flow to certain tissues. It's working on the level of your brain and increasing your desire pathways. So sexual health is one of often the earliest indicator of vascular dysfunction. And the reason that is for men specifically, erectile dysfunction frequently precedes overt cardiovascular disease by several years. Why? Because the arteries in the penis are much smaller than coronary arteries, so the arteries around your heart. So endothelial dysfunction, this term we've thrown a lot during this webinar so far, is oftentimes the first thing to show up in the penile arteries before it shows up in your cardiac arteries. So when a man presents to clinic complaining of erectile dysfunction, or maybe is not waking up every single day, 7 out of 7 days with an erection, I have to think as a provider a little bit more critically about nitric oxide production. Do we have a little bit of insulin dysregulation going on? Where's the inflammation? Is it there? How high it is? And our hormonal status. So is testosterone at an optimal level? So PT141 works centrally on desire pathways. It doesn't fix endothelial dysfunction. So it's not a cure-all, which means that if someone has desire but no performance, we need to work on vascular health. So we need to work on a little bit of a different bucket. So if you have sexual symptoms, don't ignore those. They're often early warning signs and not just relationship issues. It's something that you should address with your provider. So next is going to be sermorelin. This is something that we often use here at the clinic too. It's widely prescribed. Sermorelin is a really common peptide that stimulates your own production of growth hormones. So it's encouraging your body to release more growth hormone versus me just giving you growth hormone directly. Growth hormones supports and influences lean muscle mass. Again, that single best indicator. If I had to pick one, it might be lean muscle mass of your overall longevity. It supports your fat metabolism. So growth hormone's really important for having a healthy fat mass percentage on your body. It supports your recovery, and it's huge for sleep. So if you've got any sleep disturbances, we should look at sermorelin as a potential option for you. By supporting lean mass and reducing fat mass, it may indirectly support your metabolic health. So growth hormone naturally declines with every decade of age. This isn't anti-aging magic. I do have some patients come to me and they want anti-aging peptides. That's going to suddenly reverse everything. It's not the case there. We're supporting a normal physiology here. And it works best in the context of lifestyle and metabolic optimization. So sermorelin alone is not going to be a cure-all for a lot of the conditions that we've gone over today. But it works the best as conjunctive care with some other lifestyle and metabolic optimization. So like, for example, doing your testosterone as well. So context matters here. Making sure that we're having healthy lifestyle habits, that we're sleeping well, that we have some resistance or weight training into the mix there, and nutrition remain foundational for patient care. All right, so putting it all together. So how do we bring this all together? Heart health, it's not just cholesterol. It's hormone balance, it's body composition, which is something we test for here at the office. It's insulin sensitivity. It's making sure inflammation markers are low. It's making sure that we're sleeping well and for enough time, so sleep quality and length. And it's making sure that we have important healthy emotional connections in our lives. So that emotional connection and intimacy component to this. So when my patients come in and they say, I'm tired, I have no libido, I'm gaining weight, I don't feel like myself. I hear that a lot. I just don't feel like myself anymore. I don't think that it's just aging, like, oh, you're just getting old. You might hear that from your OBGYN, which if you have, I'm sorry. I think it's your physiology. We've got to fix something there. So testosterone is just one piece of that, but it is an important one. So low libido and fatigue are not just inconveniences. They're not just signs of getting older. They may be early warning signs of metabolic strain or cardiovascular strain. Optimizing your hormones safely and thoughtfully can support not just how you feel, but potentially have some really positive long-term health outcomes. So obviously I want my patients to feel better. I want symptom improvement, but there are other important reasons too why we replace testosterone in both men and women. And that's because of all of these physiological conditions we've discussed. So if you're experiencing low energy, decreased libido, difficulty building muscle, so if your CK scan here in the office is looking a little bit sad, maybe increased abdominal weight, so that visceral fat accumulation around your midsection, or again, just feeling not quite like yourself, it may be worth evaluating your hormones in a really comprehensive way. In our practice, we don't just check testosterone. We look at all kinds of different things. So if you've had your labs drawn here recently, you'll know that we look at total testosterone. We also look at free testosterone. We're looking at carrier proteins for testosterone, like sex hormone binding globulin. We look at estradiol, which is one version of your estrogens. We look at your inflammatory markers, so CRP and homocysteine. We look at your lipids and what makes up those lipids. So your LDL, your HDL, your triglycerides, maybe your ratio. Often some other specialty cardiac markers. We love doing Lp(a) or apolipoprotein B. Sometimes I'll run an NPO. We get crazy. Insulin markers, so your fasting insulin, your hemoglobin A1C to make sure you're processing your sugars appropriately. And again, that body composition we're looking at critically too. Because true optimization requires context and everybody is super different. We have to treat you all as individual people with individual concerns and individual physiology. So if you're interested in learning more, we can schedule you a comprehensive hormone and cardiometabolic evaluation. You can connect with your provider here at Desert Wellness Center. If any of the peptides that we had talked about today were interesting to you and you want to know if that's a good fit for you. Thank you so much for spending time with me today. I'm excited to answer a couple questions if we have any. Otherwise, we can get you onto your lunch hour. So if you have any questions, go ahead and throw one into the chat box. Let's see. I heard that there was a shortage on estradiol patches. What are other options? So our favorite way to replace estrogen is going to be through the pellet therapy. Dr. Mateo did her webinar on estrogen and the benefits of estrogen, which should be up on our YouTube page. Last month, I believe it was our January webinar. But estrogen is best replaced in our pellet therapy, which is something we widely offer here at the office. The reason we like the pellet therapy so much is because it's the closest way that I can replace things like estrogen and testosterone to mimic your body's normal physiology. So what it would have done should it be producing those hormones in an appropriate state. So it's the closest way that I can mimic your own biology. I think the estradiol patches are only out in certain doses. So if you're really attached to the patch, this might be a sign that you should try out the pellet and see if you feel a little bit better on that. Or maybe you need to reach out to your provider. What would be a good hormone test for a 40-year-old woman? I would test hormones for a 40-year-old woman like I would with any of my 20-year-olds. You get a complete hormone test. So all of those hormones that we had tested for, all the hormone protein carriers, all of your hormones, so your different types of estrogen, your free and total testosterone, DHEA, progesterone, cortisol, pregnenolone, prolactin. I want to know how your body is communicating with your brain, essentially, on hormone production. And if those guys are not in the optimal range, we are doing something about it. Can HRT reverse endothelial issues? Yeah, I've seen a dramatic increase in endurance since starting testosterone shots. Yep. So HRT can reverse endothelial issues. When we decrease the amount of inflammation and naughty cholesterol molecules and sugar floating around, our endothelial lining can actually repair itself. It does work best in conjunction with other therapies too. So like being on some sort of nitric oxide support. So beets are really high in nitric oxide. There's a couple different nitric oxide supplements that I really like to prescribe for my patients, but that can be a great complement therapy with HRT to make sure that the lining of our vessels is really happy. All righty. If we don't have any other questions, we can kick you all off to enjoy the rest of your lunch hour. But this video will be uploaded to the YouTube page. So if you want to go back and revisit any of the concepts here, you're free to do so. Otherwise, it's always a pleasure to speak on these topics for Desert Wellness. So I appreciate you all